Chalo. Assalamu alaikum, greetings. You are listening to Light Up Pichwa, in which I have started this segment on Let's Talk, which is Baat Corona in Urdu, and it's Let's Talk in English. This is the name of the program. During this time of coronavirus, I have thought of putting this program together, and I'm getting some voices that hopefully can give a message. Doesn't have to be positive or negative, but it is a message during this time. So it depends on whom I'm talking to. So today I have a guest, one of very special guests. She's a doctor. So welcome, Ghazala, to Light Up Pichwa.
Assalamu alaikum, Shua, and everyone else who's listening. First of all, thank you, Shua, for giving me this opportunity to bring my voice to several hundred people out there, maybe thousands.
Thank you.
Especially the people in Pakistan. I am from Pakistan. I'm a physician. I've been in the US for almost, I would say, 30 years now. And I'm a practicing physician in Massachusetts, primary care physician. For those of you who don't know what primary care physicians are, basically it's the concept of having your family physician. I'm a family physician by training. So Shua invited me on this podcast today to talk about our current situation, how we are handling it, and our thoughts. So these are very difficult times for everyone all across the world. Pandemic is an epidemic that's affecting everybody everywhere in this world, and this is very unique, at least in our lifetime. It is something that most of the people at this point in time have not experienced. I mean, people give analogies of the World War, the Pearl Harbor crisis, the flu pandemic, but the 1970s. But the thing is that at that time, we were not around. So for us, this is totally a very unusual experience for those of us, old and young, around. And we hope and pray that we never experience this again. Because I'm a physician, so I think I should at least...
it's affecting.
How it is affecting our work life and our patients. And I'll just put in a few words about my advice. Take it or not take it. It's coming from a physician, but I'm not an authority on coronavirus. I may be a little bit more knowledgeable than your general audience here, but definitely I don't consider myself any authority. But as a word of advice and education, please do not take this pandemic in any political or racist twist. It is completely, it's an infection. It is across the world. It is affecting old and young and rich and poor. It is totally indiscriminate of age and sex and our ethnicities or even our political preferences. You've seen where, which I may be putting in a little sarcasm here, but that's how things are. And if you look at it more philosophically, this is something that I look at it as something God, as Allah Ta'ala, God has sent us for us to awaken, to realize what we had and what we may be afraid of losing. I mean, our faith as Muslims is that we will all die at a certain time that's written for us. How that time comes, how we are taken is in His hands. But to be blaming somebody for it or to be not cognizant of the risk that we are is not acceptable. At least that's my viewpoint on it. We have to be more positive. We have to be careful. We cannot be careless about, saying, death is written, it'll happen, so let me go out and do whatever I need to do. It's irrelevant. That is not being careful about yourself and about others.
Not to put others in harm's way as well.
In harm's way, absolutely, and that is how it has been happening.
So can you tell also about, like, you are a family physician, but you have been trained as a backup?
Yeah. So I'm a family physician in Massachusetts, in the Chelmsford area, and Alhamdulillah, by the grace of God, our area has not. We have been affected, but we are not really a hot spot for this infection as yet. We have had cases, we have had casualties, we have had deaths, we have had hospital admissions. And as a primary care physician, my practice is more community-based. It's office-based, where I do not go into the hospital to see patients, but our hospital had requested if any of the community physicians would volunteer, and I did step up as a volunteer physician. So at this point in time, I'm not what you would call the front line physician here, but I have been trained as a hospitalist and being credentialed as a hospitalist for the next 90 days. In case there is an emergency, I'm like their, you call the reserve guard, that I would be brought into action and use. And even though I'm not trying to shy away from responsibilities, but I hope that time never happens, that we run into that crisis.
Yes.
Our hospitals, alhamdulillah, by the grace of God, we are doing well. We are able to provide for all our patients. We have enough ventilators available. In this area, in this estate, in our hospital, we have no shortage of ventilators or hospital beds or ICU beds, so which is reassuring. And I want to put that message out, that fear that people have, that God forbid, if I'm in the hospital, I will not get a ventilator. Alhamdulillah, that is not the case here.
Okay.
How am I doing? What am I doing with my patients? So we are practicing telemedicine. Telemedicine is taking care of patients through audio and video, or just audio, whatever suits the patient. A lot of my patients are also seniors who are not that technology friendly, and they would rather just make a phone call. I'm fine with that. Some young people want to just FaceTime. They don't want to download a link and go through all video links, which is fine too, as long as the end goal is met. And the end goal is continuity of care. So patients who are out in the community, people who are out in the community should not feel that now I can't see the doctor in the office, I'm abandoned. There is no such thing. All doctors, not just myself, doctors are doing telemedicine. And those of you who are hearing this, if you have ever felt like, oh, you don't know what you will do now, if you are a cardiac patient, or you're a diabetic, or you have a neurological issue, all doctors are available with telemedicine. Your insurance reimburses the telemedicine visit. It is billed by the biller for your practice as a visit, so you don't need to worry about that. And that is by the policies that have been put in place by the state and the federal governments. So that fear of, like, I don't have my doctor, what will I do if I run out of medicine? What will I do if I have an emergency? I have to add here that hospitals and your physician, your primary care physician and your specialist physicians, will not be doing anything that is non-urgent or non-emergent at this time. So that, and the purpose behind that is to make sure that we have the services and the facilities kept available and open for COVID-affected patients and cases. So if you have a cosmetic surgery, or even if you have an elective surgery, say a gallbladder removal, or those will be put on hold until things revert back to baseline. So that, and some people might find that, or might hear like the hospitals are not as busy anymore, and there is no, there's a hype about the load in the hospital. So that is incorrect. The hospitals, some hot areas like New York or Seattle, those are definitely, or New Orleans, they are the hot spots, but even the non-hot spots are pretty busy. Like Massachusetts is not as yet up there in the top 4 or 5, but it's definitely in the top 10 states with the COVID cases, and the hospitals are very busy with the COVID patients. So they have eliminated or they have kept the floors available for the COVID patients, so the non-COVID cases are not being brought in. And the second thing keeping in mind is a lot of people are deferring their hospital visits and emergency room visits because they are scared that they would get the COVID infection. And to some extent that is correct. There is reason to be scared and to avoid non-urgent, but I would also send a message out here. If you think you have something which is doesn't sound right to you, you're having acute abdominal pain, acute chest pain, a headache that you've never experienced in life, please don't ignore it. Please do go to the hospital, go to the emergency room, go to your urgent care, and they will handle you appropriately. Do not sit with it. I mean, if you're having an acute, like for instance a 70-year-old smoker having acute abdominal pain which he has or never experienced in his entire life, needs to be in the ER. I mean, I'm just giving an example. Something like that, do not ignore it. So I think from a medical standpoint, I could, and then if you have questions, there's a lot of what we are doing is triaging, which means, you get the call and you screen and you see if this patient needs to be in the hospital, emergency room, urgent care, or they can stay home. So there is not an unnecessary flooding of patients in ERs and urgent cares. And that is a significant part of what the community physicians are playing. The emergency room and the intensive care will not get the care. Okay. So they will be put at the back of the line, and so we're trying to minimize that and do appropriate triaging. Okay. So a couple of things like and I want to send that message out for people, don't feel that you're abandoned by your primary care or any other specialist. They're all available. Give their office a call. You will be connected with them on a telemedicine visit. Your insurance, please remember, your insurance will cover these payments. It is in the process, but you do not have to feel that you will be footing the bill if you're having a televisit with your provider. Thirdly, if you have an issue that you are suspecting that you may have the COVID infection, please get in touch with your doctor. Okay. Too much of a physician here, but I think that message is important. Try to minimize the when people go rush to the ER for like everything, sometimes not knowing the knowledge that a lot of these things can be taken care of over the telemedicine visit. So I think medically, I think those pearls, as I call them, if people remember those pearls of practicing self-care there. Now, personal, my own, I would say, these last 4 weeks have taught me a lot personally. And I really, truly believe that Allah Ta'ala, God, has brought this or exposed us to this pandemic for us to awaken and realize what we were doing in our everyday life. And other than, I would say, maybe just a handful of people across the world, and a small percentage who have that, who are not in a rush to get somewhere, and I call it meeting deadlines. We feel like we are constantly meeting deadlines. Allah Ta'ala has brought this upon us to see where we were running, what we were doing, to have the realization of that less could be more at times. That contentment is needed. You got to stop and smell the roses. There are no roses in this current pandemic situation as far as we look at the pandemic, but there are plenty of roses in our personal life. And there is so much to be grateful for, to look at, you're sitting comfortably in a warm house or a cold house, wherever that is needed, given the temperature of where you're listening. But you have, food and a roof above you, and you have people that you love and you care about, they're with you, that you have the time to just sit and think. You have the time and you realize that you can live your life in two pairs or one pair of pants and one shirt and wash it the next day and wear it again. You don't have to show a new outfit to your social circle every day, every weekend, or 3 times a weekend.
Yeah.
And that there is something to be said about contentment. There's something to be said about what you have and what you may not need again. And I think personally, it's an eye opener to say, do we really need all that we were running after?
Even food wise, right?
Food wise, even
material wise, and
luxuries wise. Luxuries wise.
Yeah.
But I may add a little here. Yes, one thing that you will never have to. I think what we all do need and we can't do without is Wi-Fi.
Yeah, that's true.
Without that, I think any one of us could have survived this corona pandemic.
Yeah, that's true.
So ending this on a positive note, Shwa, that I hope things get back to normalcy soon and we all get to see each other. I miss not giving a hug to my friend who lost her dad, and I think that would be the first thing I would want to do when this thing is over, is go visit her with her mom, visit with her, give her a hug, tell her how sorry I am. And because, she lost her dad last week, and these are the times when you want to be with somebody. That's where you feel helpless.
Yes.
So God willing, Allah ne chaha, zindagi bakhair, we'll be together in better times.
Inshallah. Thank you, God willing. Thank you so much for your time, Dr. Ghazala, for your comments and your feedback in many ways, and also your information about all that you shared, especially in these current times. And I hope we will talk again in post-corona, I would say. We should say. Maybe I'll have the title of the program, Post-Corona Conversations. So I hope we can do that, and people I know that are suffering can come out of this suffering soon, and somehow their suffering is lessened. And we need to just check on each other. The message is that.
On each other, check on those that the seniors who are living alone and can't be visited by their family, their grandchildren. That's their only light.
Yes.
In life.
And less privileged, or that those communities that you think need you, we should try to find ways how we can assist and help them.
There are many ways we can assist.
Yes.
Making masks is one. Everybody is making masks, which is very good. Absolutely. But maybe somebody next door can go out for groceries. Sharing your own meal with them is helpful. Just I did that for a neighbor who was not doing well. I did not go into the house because she was suffering, and we would put the food at the door. I would message her and she would take the food. Because those are simple things, and it doesn't have to be a lavish meal. There are many ways you can help, but please don't expose yourself. If you're not properly protected, you're not doing anybody good.
Anyways, thank you again, and hope to talk to you soon again.
Thank you, Shwa.
Thank you.
Thank you. Thanks.